Amputation is definitely not the only option. I think it is important to get the message out there that most of these diabetic foot ulcers can be saved. The trick is that they need to come and seek treatment early, get the appropriate treatment, and most of these leaks are salvageable.
Basically, diabetes is a very common condition that can affect many organs, the kidneys being one of them. And it actually affects the blood vessels, be it in the microvascular or what we call macrovascular point of view.
The most challenging problem faced by this is that this is often a complex problem. If left untreated, they will develop infection, and when the infection spreads out and they lose more tissue, then it is much more difficult to save the legs at that point. And so they require very specialist care, and they need to see a vascular specialist as soon as possible to assess the state of the circulation to the leg. And if the arteries are blocked, then they need to undergo the appropriate surgery or treatment or a small procedure to open up the leg arteries to get enough blood down to the wounds. And therefore, it is only by this method, that the wounds can therefore heal and the legs can be saved.
Being a nephrologist, the first thing is that I need to stabilize the patient's kidneys function, and also I need to monitor and also control the blood sugar. Vascular point of view, Dr. Edward Choke, Professor Choke will open up the blood vessel, and then from my point of view, I will care and I will deal with the root cause. We work as a team. We work with the wound care nurses, the dietitian, and also the other nurses, anyone in the team, to give the best to the patient.
The centre will specialise in treating diabetic foot ulcers, whether it could be the very small diabetic foot ulcers which are easier to treat, to even the most complex large infected wounds in the diabetic foot. My message to them is to not give up hope. There are alternatives. There are ways for us to save the leg. And so the important thing is not to lose hope. And through maybe a few weeks to a few months of management, we can get their family members back on track towards wound healing. And the ability to save the legs is quite high. The chances of saving the leg is high, so do not give up hope.